Aerosols are airborne particles. They can span from the size scale of diameter of a human hair down to molecular dimensions. When we breathe, when we speak, when we cough, we generate aerosol in the respiratory tract, and then we exhale those particles. And those particles can contain pathogen, they can contain viruses, bacteria, and that can lead to the transmission of disease.
Through developing the better understanding of the physical, chemical, and the biological properties of aerosol, we can better understand the risks associated with airborne disease transmission. And it was especially important during COVID pandemic because we had to understand the factors governing the spread of the virus. During the pandemic, we measured the amount of aerosol as well as the size of the particles. And we did the measurements during breathing, speaking, singing, exercising, or playing wind instruments. One of our experiments showed that loud speaking generates 20 to 30 times more aerosols than quiet speaking. We studied also the mechanism of the infectivity of the virus and showed that if you increase the level of carbon dioxide in the indoor spaces, you can also increase the lifespan of the virus.
Our work helped understand the risks associated with those processes. When we sing, how much respiratory aerosol do we generate, and therefore how much SARS-CoV-2 virus might we be shedding. And so our work really informed public policy as we came back from lockdown into what activities were safe to do and in what context.
The Centre is a world-leading institution. We bring together a broad range of academics and industrial partners working in the field of aerosol science, and we're really there to provide training and research and further our understanding of aerosol science globally. So through the Centre, we've been able to develop resources to improve public understanding of disease transmission and to produce educational resources that are available to global scientists and also clinicians working in the field.
In the future, we may be uncertain about how the pathogen transmits, how likely it is to transmit through the air. And really our research gives us some early insight into what are the factors that might govern the airborne transmission of the disease and how we may mitigate the spread of the disease and prevent people from becoming infected.